Approval of reading and approval of minutes from February 27th meeting. And I'd entertain a motion to dispense with the reading and adopt the minutes if it's approval of the commission.
I move that we approve the minutes for the Thursday, February 27th meeting 2025.
Dispense with the reading.
Dispense with the reading.
Is that what I heard? Yeah.
Yes.
And we have a motion and a second. So all in favor, aye?
Aye.
Any opposed? No. Thank you. The reason I'm changing up a little bit tonight is, we had a few things we needed to adjust because of the open meetings law. So, you have to have a voice vote in the open meetings law, and the public comment. You can do it many different ways, but this is the way they recommended at the beginning of the meeting. All right. Reports of standing committees and Mr. Anthony.
All right, well, good afternoon. Thank you, board, and thank you to our visitors that we have this afternoon. I would like just to take a moment before we move into our finance. Glad to have you, Mr. Rudy.
Thank you.
How you been?
I'm glad to be
here. Good deal. Miss Shavery, how's everything going? You been busy, huh? Good, good. I know. And y'all know Miss Cynthia Buggins. So Miss Cynthia, she's with us. We're glad to have Miss Cynthia. We're gonna be working with Miss Cynthia for a couple of projects, and she's gonna be helping us with a couple more things. So I'm glad to have her. I invited her to be here. Miss Cynthia, you want to say anything?
I want to say good evening to everyone. It is my pleasure being here. Thank you for recognizing me, and thank you all for having me. I'm looking forward to all of the possibilities. Good to see all of you.
Good to see you, Cynthia.
How you been?
I'm fine. I've been from day one.
Yep.
well, good.
Good deal. In the back, you good? How you doing? Good deal, Mr. Show. How you doing this afternoon? All right. And then I also want to introduce and to tell y'all we have our auxiliary team that we have at the hospital. So a part of our outreach and what we're doing of reaching our community members is, giving back to our outreach and our ladies. So we have the president that's here, Miss Sheila. How you doing, Miss Sheila? Good. All right. And then, I was about to say, Ms. Dorsey. But Ms. Dorsey and I love all of our ladies auxiliary. They do a wonderful job with taking care of our patients each and every day. So I'm glad to have them here. And of course, we got Ms. Dago in the back. Ms. Dago, how you doing this afternoon?
I'm doing wonderful. Thank you, guys.
Good. Well, board, I promise that I'm not going to hold you this afternoon, but I do have to go over a few things, and it's about our financials. All right, so let's jump into that. This is our income statement for the month of February. And look, I got me a little clicker this time. So yeah. All right, we fancy. So if you look at our actuals, net patient revenue was at 1.3 million. Other operating was at 210. Revenue for the month is at 1.5 million. We budgeted for 562,000. When I look at all of my employee-related expenses, as well as purchase services, occupancy, supplies, net operating is at 863. We have a net positive for the month of February of $661,000.
Well,
You budgeted for 18,000.
well,
We made $661,000. That's because of our inpatient unit. All right. So this is a positive for the district. This is a positive for our hospital. This is a positive for what we are doing, the continued growth that we have in our hospital. Year to date, we're at 4.7 million. We budgeted for 2.6 million, with 2.6 right now. Looking at a total of 1.2 million, we only budgeted for 108,000. It has been offset. So, board, thank you for entrusting us and our leadership team of making sure that we're at 1.1 million over where we need to be at right now. So, your income statement is a positive for the month of February. When we look at our balance sheet for the month of February,
can we do you mind going back?
Yes, sir. Yes, sir.
Well, I'd like to better understand the inpatient. How many rooms did we use?
So in the month of February, Mr. Dawson, you had roughly 15 observation and 3 inpatients. On that inpatient side that we had for more than 24, 48 hours, we looked at wound care patients, looked at IV therapy. That netted on average a $1.4 million increase. The reason that we are looking at that is because we did not account for inpatients at the beginning of the fiscal year. But now that we are seeing that being a critical access hospital, we have that reimbursement. Okay, so it is paying off the way that we need it. Yes, sir.
Now, are those inpatients, are they coming from other places that don't have inpatient?
So I have had 2 recently that came from another facility within the area. We was able to take their patient here, and it was a low acuity level patient. However, they didn't have the bed service at their facility, but we was able to accept them here. Yes,
So remind us all, how far where do you have to go to be able to stay in a hospital room on the West Bank?
So on the West Bank, when you're looking at it, Mr. Dawson, we are the only licensed facility from Thibodeau to Livonia. Okay, I have a license.
So Thibodeau General has inpatient?
They have inpatient.
And Livonia?
Well, we think about Funky Pete.
Okay.
So you don't have, on the West Bank, we don't have critical access, we don't have licensed beds. Now, we do have observation beds at my partner facility in Assumption, but they are a rural emergency facility there. But they do have observation beds. But we are the only licensed beds on the west side right now.
Do you have any idea what the population of that is? It's quite a number of people.
That is quite a number. Mr. Price and I was talking yesterday, just for the Donaldsonville area, Mr. Price, you mentioned 6,500?
Well, in Donaldsonville, our current population is right at 6,700 residents.
Okay.
But in the entire West Ascension, though, you're now approaching somewhere around 11 to 12,000 residents. Okay. All right, so we're serving our entire West Bank here, but as you just said, we're also serving all of the areas in the geographical area because
yes,
they too don't have the licensed beds.
Yes, sir.
At their hospitals. We have it here at Freedom.
Yes, sir.
So I would say we could get close to 100,000 in the West Bank area.
Yeah, absolutely.
That's right.
Absolutely.
On the west side, that's right.
Yes, sir. This income statement, and for our community members, this income statement shows that the board, as well as this administration, is devoted to patient care. We are devoted into taking care of our operations, and we are also looking at what can we do for continued growth for the West Ascension Parish Hospital and the west side of the river. So this is a positive for us. I want to be very clear. You know, in healthcare, and Mr. Rudy can attest to this, healthcare is about ups and downs. We had a good month. We had a solid month. We had a lot that came through in this month. That's not to say that every month's going to be the same. However, we have put the tools in place where they need to continue to have a positive and for us to continue to meet our bottom line. So I'm glad for this. Any more questions on our income statement? If not, I'm going to look at our balance sheet for us. We started August 31st. We started the balance sheet at $33 million. We brought in $1.4 million, which give us a total of $34.8 million in total assets. Your cash and equivalents, you had $24 million. Had a slight decrease, and only because my net patient AR transitioned. And the reason why it transitioned is because we're bringing in data search. Data search is our collection. We have a lot of bad debt. So we have a lot of collections that was not being accounted for. So what we're doing now, we're trying to capitalize and trying to get some of that money back. So you're going to see that that's where it needs to be. So it did increase slightly, 292 on inventory here. Prepaid expenses were at 246. Current assets total is 28.4 million versus 27.6 million at the end of the fiscal year. Fixed assets is read at 6.4 million, giving you a total assets $34.8 million. And like Mr. Price likes to say, where we were before compared to where we are now. So you can see that on a balance sheet, we have a very healthy balance sheet. However, I have already instructed my team to make sure that we're looking at cost reduction, make sure that we are making sure that everything needs to be in place where it needs to be. And the rewards are showing that we are in a strong financial place that we can look at strategic next steps of how we're going to continue to grow our organization. Any questions on the balance sheet?
So just one comment, I'm sure everybody's, watching on Monday.
Yes, sir.
And our parish president was at the White House and announcing this big expansion on the West Bank of Ascension Parish. So, we are going to have to take that into account.
Yes, sir.
When we build the future budgets. And, from what I understand, it's going to be in this calendar year, they're going to start manning up for the construction work.
Yes, sir. Well, I'm going to, look, that is great. Now I'm going to charge our board to work with us, work with the district to look at what a strategic plan is going to look at by looking at what we can do. We have to grow, and we have to be able to meet those needs of future development and growth in the parish. And this is a win for our community to be sure to have a plant like this come into our area. So it's great, and it's a great honor. So thank you for.
Well, and I think one other thing is that there's going to be a 65,000 square foot training facility that's built, paid for by the state of Louisiana. And included in that is, we did some negotiations with River Parish Community College, and there's going to be a skilled nurses training program in that. And,
yes, sir.
And I think it's, it's possible that can be located very near us.
Yes, sir. Yes, sir. Wonderful.
Yeah.
I welcome it. I welcome it. Yes, sir. Yes, sir. Any other questions about the balance sheet? If not, let's look at our capital analysis. The board allowed for us to have approval of $1.7 million. Ms. Tanya, we still got $1 million left, so you still good now. Now I'm gonna come to you next month because I need to use some money for our CT machine, but I'll talk to you later on that. But again, we was approved for $1.7 million. You can see we've been fiscally responsible. We only had $686,000 that we've spent on necessary needs and equipment that we had to get for the facility, such as your beds, like I mentioned. We also just bought 8 new stretchers for our emergency room. James can tell you about that. We are expecting those to come in within the next month. So it's those needs and those equipments that we're doing to give our staff what they need to be able to treat our patients properly. You would think about, I had stretchers that were 30 years old. Totally unacceptable. I'm not going to tolerate that in our hospital. The board does not want that. I don't want that. Our patients do not want that, and the community doesn't want that. So we are investing back in our community, which is the reason why we have this healthy balance sheet. Having a healthy balance sheet allows us to be able to invest into our organization. So we still are doing good, Mr. Dawson. You don't have to worry about.
Well, I do want to. It's a great thing that we have this balance, this $1 million balance. I think all that really means is that we postpone that spending.
Yes, sir.
The spending still has to come. We have
yes,
to
sir.
Either renovate part of this facility or have to build a new hospital, and it's going to be a tremendous amount of money. So I wouldn't get cocky about that.
I'm not.
$1 million. I don't mind you being a little sticky chest out there.
Yes.
It's important, but.
Yes. But we do have some things that James and I and Mr. Quincy are already looking at, things that we need for the hospital to continue our outpatient service lines. As we look at our sales tax and income tax, in the month of January, we brought in $185,000, which posted to our deal on February 7th. And for the month of February, we brought in $125,000, which was posted on March the 7th. Prior year, we brought in $155,000. So right now we're hovering around $873,000. So we're still doing well from the sales.
Yeah.
This is just our budget review. This is telling on net patient revenue from actual to budgeted. So actual, we're at 9.1 million. Budgeted was at 6.7, giving us our 1.3 million for where we're at right now for net income. So that concludes my financial report at this moment. Any questions on the financials?
Well, I think we're, Falcon and I were just discussing this, but that's a healthy amount for 185. I think that's above our average.
Yes, sir.
Not quite at the top of the list, but I think we also, you know, this is gonna be one of the sheets that's gonna really be affected by that development in modems.
Yes, sir.
You know, the half-cent sales tax is gonna increase significantly.
Yes, sir. Good deal. Well, like I mentioned before, we want to be able to be sufficient on our net patient revenue. We want to be able to use this money as our line-up money. That's been the goal of the board, to be able to not have us to depend on the sales tax, but be able to use the sales tax for further investments, for further wellness and improvement for the district. So this is what this money is for. So we do appreciate the board advocating for us on this. Mr. Falcon, any questions for me?
I'm loving it.
All right. So that concludes our financials. Moving into our monthly standing committee reports. Mr. Dawson, you can time me, okay? So today MEC,
internal timer.
yeah, internal timer. All right. So our MEC, we met on March the 18th. Had a total patient visits of 11. We had 2 admits, 2 consultations, 1 observation referrals, 0 on the Medicaid, 0 on my monthly denials, physician quality problems, as well as my notice of physician quality problems, admissions denials under Medicare and LACR review was 2, and Dr. Lewis is here this afternoon. Doctor's way, because you can't talk. So doctor's not feeling well, but Dr. Lewis and her team was able to go out into the community. We was glad to be a part of the numeracy night, and we had 75 students that participated in STEM literacy. So we are glad to be able to participate on that. Also,
Well, can you tell me a little bit more? And then this steam is putting up there, you know.
go ahead.
So actually, that's overtitled STEM.
Yeah.
So, Ms. Tanya was there, but basically, we try to go out and support the community on an educational standpoint. And, we try to incorporate, health with STEM. And so this was an opportunity that the school, where we were invited in, so we were able to go ahead and buy some sensory items. We were able to use the pre-post cups that turn colors, like a science experiment, hot and cold, and so the kids were able to do like a little science experiment. So this was a good community outreach thing to support.
And what, did you go to a particular school?
Yes, we did. Well, we supported the entire west side.
Okay.
Donaldsonville Primary, Glory Elementary, and Glory Middle.
Okay.
And this is to support and get parent engagement as well as parent involvement with their students, showing them just different activities for STEM and math and engineering activities, as well as exposing at the hospitals.
What organization do you work for? I'm sorry. Do you work for the school board
I
or
work
Ascension
for-
Parish School Board?
I work for the Ascension Parish School Board and
Okay.
also work for Prebos as the social worker here, and I'm the counselor and for Ascension Parish.
You're pretty busy.
I am.
And Doc, we're glad you're here. And that was excellent what y'all done, though.
So one other thing that Dr. Lewis does, all of our inpatients, all of our observations, Dr. Lewis puts her eyes on those patients. She goes and meets with them, and she makes sure that our complete care continuum is completed. So she is very busy, and we utilize her all the time. So we are glad to have her services with us. In addition, we do have to report that we had one elderly abuse allegation that we had to report on.
Yeah, so basically, our kids seem much into people over there. we are responsible for meeting the criteria of abuse. So we are mandated reporters, so we have one report.
Yeah.
And that could be a child abuse report as well as a elderly abuse report as well.
Well,
Or any type of human that might meet the criteria, we're just mandated reporters.
you don't do anything with the early learning center, do you?
I came from early childhood, it's been a while, but I mean, we can go in and support as well.
Well, the reason I'm telling you is that they look for places to expand it's very young kids, obviously, but they look for places that they can introduce them to different things, and I'm wondering if there's something in here that they can make a short trip over here, or some other, yeah. 'Cause they're looking for places to bring the kids, I'll be honest with you.
Okay.
Thank you. So on our QAI review, 2 admissions, 11 observation, 1 discharge, 2 deaths. Wound care total patients at 42. Didn't have to report any specimens for my ER and my pathology review for the month. Looking at my monthly patient volumes, and I know everyone probably say, well, Shelton, tell me what's going on, bro. You have, in January, you was at 405, and then you have that drop, okay? So we think about February is my short month. We had 379 registered ER patients with 75 total x-rays, 73 on my CTs, 2 administrations that were completed, 21 transfers to a higher level facility, and out of that 21, 11 went to Our Lady of the Lake. AMA, we had 7, returns within 72 hours were 7. So the reason for the drop in my total patients on my ER, but on your net patient income was an increase. So yeah, we have a drop, but you increase on your inpatient. So that kind of offset made our balance sheet look the way it needed to be. We have seen that our numbers have went back up to where they're supposed to be. So we're good with that. I was a little concerned. I went to the team. I was like, well, what's going on? But then when we saw that we are moving into a point where our patients are using the ER for true emergencies and not just using it for primary care. So that's what we want to be in. You know what I'm saying? I'm going to take care of you when you come here. All right? What I can't do, or what we can do, but what I can't do is manage diabetes in the ER. You know, I can put Mr. Dawson on metformin today, but Mr. Dawson will have to follow back with his primary care to make sure that he's taken care. But then Mr. Dawson comes 2 weeks back to the ER because he hasn't taken care of his blood pressure, or his diabetes, So it's things like that that we have to make sure that we are providing for our patients. But ER visits are continuing to go back up, so I'm okay with that. Nursing documentation, Dr. Levy, we're back to 98%. The reason being that because we had 80% on pain reassessment after the pain medication was given, but 100% on presenting the complaint, documentation of your pertinent information, as well as your vital signs, 100% with my compliance with correct transcription, and compliance with documentation. So if I was saying, Shelton, out of those 20, we only had 2 that fell out on the pain reassessment, but I did speak with those nurses and Miss Anastasia, and Miss Shaver can tell you I was up there. I need to know why you at 90%. I want to be back at 100%. So I will tell you we will be back at 100% for the month of March. So we're all good there.
That's reassessment. What is it? Oh, pain reassessment?
Yeah.
Okay.
So, Ms. Crystal, can you speak to that?
So when
Yes, ma'am. We can hear you.
okay, I know there's an echo sometimes. Still echoing.
Go ahead. You can go ahead, Ms. Crystal. Good.
Okay. So along with CMS and Joint Commission, when a patient has been administered any type of pain medication for therapeutic value, we must reassess within a certain time frame. And so what we have to do is perform clinical audits on the charts. I'm sorry, I'm hearing like a feedback.
Go now, Crystal.
I muted us, so.
You good?
Okay, I'll try again. Oh wait, it's still going. Do you want me to call again, Shelton?
Call in. Call in. Call in. Ms. Sherry, you can speak to it.
So, in essence, what she's trying to explain is, anytime you give a pain medication, you have to go back in and ask the patient, has your pain gotten better? To see if the pain medicine is working or if it's not. Because then the pain will need to be readdressed. If it's not working, if the medication is not working. If it is working, then you know that what you've done in the intervention that you've provided has done well for the patient.
And when you do that, you must document it.
Correct.
That's a part of the problem. They may be asking the questions, but they're not doing the documentation.
So we are definitely working on that. Definitely working on that. We got it, Crystal. We got it.
Okay.
Good deal.
And then Sheldon, before you continue, let everybody know that we got a new system that we are using right now, and so we're just working out to get this.
Yes. So if you can look,
Thank you guys.
yes, ma'am. So the next slide goes over our ED census throughput. This is the providers for February. So it can show I have Dr. Clausen, Dr. Fisher, Dr. Edawu, Dr. McGee, Dr. Panukalu. This shows the visits, time to triage, time to provider, time to total ED. So this just shows in minutes where we're hovering at. The next slide goes to your ED throughput from January to February. As you can see, Dr. Edawu has a total of 329 patients that he's seen. So he's doing good. Dr. Edawu and Dr. Panukalu, 329 to 4, who got the most patients. So that's the little rivalry they got going on. But it's a good, healthy rivalry. And our lower physicians, Dr. Clausen comes twice a month, right, James? Yes. As well as Dr. Fisher, he comes once a month. Dr. McGee is one of our regular physicians, and Dr. Sharp. All right. This is just another breakout of February where we're at. We are meeting our benchmarks at this time. This is your ED deposition. Also looking at from January to February, I wanted to go right here to psychiatric hospital. This is for our transfers. And it shows that we've had 2 from Dr. Edawu and 1 from Dr. Panukalu. That's going to change coming up this month because I've actually had 5 pediatric transfers that we've had for the month of March. Okay, that is a significant increase in our area. But that lets us know that our babies are really going through some struggles. Okay, so we really have to focus and work on that. That is another part of the strategic development that the board is looking at. What can we do to help assist, help and keep our babies here? Because let me tell you, it breaks my heart that Dr. Lewis and I, we have to get on a phone call where we have to send a child and they live down here. That's a 4.5-hour drive away. Shayra can tell you, it breaks her heart. She sees it every day as well. So what can we do as organizations to try to keep our kids here close by? So we are definitely working on that. So monthly ER test positivity rate, flu A and B. Mr. Dawson, we ordered 93. You have 14 that was positive. Strep A, we had 72 that was ordered, 4 that was positive. RSV, 13 that was ordered, but 0 that was positive. And COVID-19, we had 91 that was ordered and only 2 that was positive. So doing good. And that's what we want to do. We want to keep our numbers low. So I tell everybody, please make sure that you're doing what you need to do. Dr. Lewis, don't be doing all that, Dr. Lewis. So respiratory hours, we had a total of 7 ABGs that was conducted. James had 600 oxygen hours with 86 EKGs. but that's a positive for our organizations as well. You have the environmental care plans. Our Kenwood radio test is being completed, and our generator load test is every third Thursday. The safety risk management plan, Mr. Jared is here, so he can speak to that later on. Our utilities management plan with our line isolation and your medical gas testing was all completed on the 24th. Your fire prevention plan, life safety management plan, your fire extinguisher inspections were completed on the 23rd and 24th of February, with your oxygen cutoff valves being completed on the 23rd. Our fire marshal will be coming for their annual evaluation. Ground fault testing was completed on the 10th and the 17th. I've had no security issues. Egress lighting was done on the 23rd. We have the approval from last board meeting for our hazardous materials and our waste management plan, so that is in place. So thank y'all for approving that. Your emergency showers and the shower use have been updated right now. We're looking at sir?
Do we have a joint commission? We think that we know when the next one might be. Is that correct?
So we are moving into our window of survey, and we're going to explain that a little bit more.
Okay.
Yes, sir. No activity now on your emergency management plans. If you look at there, I'm proud to announce that we've had 0 occurrences for physicians, outpatients, and visitors. That means we are moving into a safety environment, and that's what we want. We want to move into 0 harm, okay? My staff can tell you, they get tired of me every day because I'm saying I want 0 harm, 0 harm, 0 harm. But it's because of the work that we're doing to make sure that we're keeping this where we need to be. To date, you have 38 cameras that are monitoring 24 hours a day, the facility. Product recall, we had 1 that was listed. Fire drills and emergency drills are being completed monthly. Your annual training for all your staff is currently ongoing. And look at there, 0 patient complaints. That's wonderful. That's what we want. That's what we want to see and continue to see. My cyber team, they was able to meet this month. The quarterly anti-phishing campaign update. Out of 64 random selected users, we had 22 of my staff open the testing position email, but no one clicked the link. So that is good. That's what I want. That's what we want. In the past 30 days, 195 exchange messages were quarantined and confirmed to contain malware or links to download. So I'm going to tell you about that. So I have a board member, I'm not going to call his name, Mr. Price, has a Gmail account. So Mr. Price, Gmail was all going to quarantine. So he kept saying, Shelton, I'm emailing you, man, but you're not responding back to me. Well, I kept saying, what? You're not emailing me? Guess what? It's because we had our exchange quarantine up, and it blocks. Dylan, explain why we have the quarantine set up.
I'm in a spot like this.
But it's so I'm gonna say that for deals.
But the main point is that any potentially dangerous emails that our systems find, they scan every email that comes through, see that any that could be potentially malicious, and prevent those from getting to users. So, anything that install like a Trojan or any sort of software on the device that could, start stealing data from us. Just any links they could click on that could compromise our devices. It's constantly looking for stuff like that's being embedded inside these emails.
So what we're doing, Dylan and his team with Brock and Will, we've locked down everything, so everything has been monitored so that our patients' information and our patients' data is secure that we have here. So that's another reason why. So when we do have vendors or someone that's telling me, well, Mr. Anthony, I am emailing you, I do reach out to the IT team. We do check those emails before we move forward with those because we want to make sure we are doing what's right for the hospital. Workstation endpoint audit identified 2 machines that were, one build behind the antivirus software. I have updated the antivirus software for that. SharePoint file storage is up 223%, and our general user activity with Microsoft 365 apps is up. I like to see that because we are now moving to a more secure with our SharePoint. So everything that we're doing is being backed up for the server. So that's good. But this just shows you our cyber report that we have. Leadership team and administrative updates of general education.
How do you have somebody that comes in and checks that, or how do we, is there some way to know that we?
So we have a complete IT. We have a complete IT department and IT team, and we have one programmer that all he does is make sure that everything that we have going in and out is safe for our patients. So they are constantly monitoring that. The server is locked down and secure. I made sure that our server is secure and locked down, and that is not easy.
So it's ongoing, you don't have some particular cycle that's set up to go and do a
It's
evaluation?
It's ongoing.
24 hours and they'll send an alert, if something's wrong, an alert's gonna go to the team.
Yeah.
Okay.
We will stop when it needs to be right then. The reason when, and Mr. Rudy can tell you, Change Healthcare, we don't want to get into a Change Healthcare situation. And when I came here, I made sure that we locked down everything because we do not want to be in that situation. No, sir. So I'm a little protective about that. Leadership update. So general education for all the staff is being completed with Relias, and Relias is sending out updates and notifications. I'm gonna tell y'all this a fun little story quick. The staff came to me and said, "All right, boss, look, stop with the emails." Well, look, Shaver can tell you, education is key. Education, education, education. The reason why we're doing this, and Mr. Jarrett can attest to this, we brought in Relias at another facility, and we're bringing it in here. Relias helps to make sure that our staff are up to date with where they need to be with their education. Because I want to make sure that a patient that comes into our ER, that my staff is competent, my staff knows what they're doing. So if that means reminders to make sure that you check and Relias and you're doing that, then that's what you're going to do. We have a little joke that's going around that our educator, she's sending out reminders, and she said, "Look, if you don't have this reminder, I'm talking with you and your manager at the end of the month." Well, it's getting everyone to know, guess what? You got to take education serious, and we are demanding education now. So, staff and department leaders being introduced to Hardwired Excellence by one of my mentors, Mr. Quint Stewart. So the student approach is where we are moving at as far as continuing education for your leaders, continuing education for our organization, moving into that zero harm area. Nourishing Soul Cafe, that's our new name for the cafeteria, Nourishing Soul Cafe. We have new menu options for inside orders. We're continuing to improve our service and our dining experience. We're going to have some small renovations to take place in our dining room. Once completed, we're going to be able to provide salads, wraps, sandwiches, fruit, and dessert options that will be available daily. We're going to have a grab-and-go cooler inside there, so our residents can come in, can get a nice salad, get a nice sandwich, get a nice balanced meal in our dining area, in a cooler area, so you don't have to be waiting. So that's going to be a positive coming for our team there.
And that's going to be for the inside?
No, sir. It's going to be for the outside.
Is it takeaway too?
Sir?
Is it the pickup and also?
Yes, sir. Yes, sir. Yes, sir.
I'll tell you this, I'm going to get a lot of positive feedback on the cafeteria.
Yes, sir.
I don't know if we have good health care, but we have good stomach care.
I'm going to share a quick thing with a community member, told that I don't verify her name, say her name, but she came in and she said, "Well, Mr. James, I don't live on a big income, $700, $800 a month that she bring in." And she said, by coming here, I eat for $8 a day. And that's the only I can't afford to go to the grocery store or Walmart to pick up groceries, but I can't eat for $8 a day. So that's a big community service that we just thought of.
Yeah, I agree 1,000% with that. That this is something that we can do for the community. It doesn't cost us a lot of money, man. Can have a big effect.
Yes.
Yeah, and the price,
Can be.
breakfast, a full nutritional breakfast for $3, a full nutritional lunch for $5.
Yes.
You can't tell me the volume is not increasing because more and more people are telling us they're going over to Prevost. All right? I mean, but hey, that's a great thing we're doing here, man. It's one of the greatest things we're doing here. And we're also getting a lot of positive feedback on our health care, too.
Yes, sir. Yes, sir.
All right, so yes.
Yes, sir.
Everything is moving good.
Good. All right. So, Mr. Dawson, I'm over. I'm done.
You done?
I'm done.
I didn't see you done. Okay, Chairman report. I don't have anything specifically, board members. Don, you have anything? Falcon, Ben, Dr. Levy? No. Okay. I'm gonna turn that back over to you. Yeah, I'm gonna turn that back over to you.
Okay, well, thank you. So for our new business this afternoon, everyone, we're going to go over our application for review for full privileges. We have an update with our health system, the 2024-2025 audit response. We have 15 infection control policies that Ms. Crystal and I are going to review. We're going to talk briefly about the Joint Commission preparedness with Mr. Quincy, and then we have our board standing education. We have our February 2025 social determinant of health needs assessment for the month. We have a RestoreX update, that's our wound care education with 360 Life Safety as well as Reliance education. Mr. Price is going to give us a brief update on our hospital van. We have some strategic planning for primary care clinic consideration as well as a potential modular building consideration. Upcoming events, I do have a local ceremony for our organization. We have an Easter egg hunt celebration at the WAG Center, Nurses Week 2025. We have Hospital Week, and then we're getting ready for our community health fair. I'm gonna give a brief update on our CMS Medicaid Medicare cost report update. And then Ms. Crystal is going to give her Southern Evals update, and Mr. Jared is here. They're going to give his consultant update for 6 months. We have the investment RFP update, and then I'm going to go over briefly with the USDA distant learning and our telemedicine grant and where we are with that process. Also looking at our operational budget and capital budget planning, and then at the end, we have a proposal for our master plan for West Ascension Parish Hospital. All right. So basically, going into new business, like I said, our MEC met, and they did approve our physicians. Briefly going over Dr. Joseph Seifel from Baton Rouge Cardiology. Then we had Dr. Kevin Kilpatrick with Baton Rouge Cardiology, Dr. Jane Hurd with StatRad Radiology, Dr. Jonathan Cole, StatRad Radiology, Dr. James Frencher with StatRad Radiology, Dr. Amy Hassan, Tulane Neurology Telestroke, and Dr. Martha Robinson, Tulane Neurology Telestroke. All are up for permanent full privileges.
I think you're gonna have to take them one at a time.
Okay, yes, sir. So could we entertain a motion for Dr. Joseph Seifel and Dr. Kevin Kilpatrick with Baton Rouge Cardiology for full privileges?
So moved. Second.
Okay. Any objections? None? Next.
We have Dr. Jane Hurd, Dr. Jonathan Cole, Dr. James Frencher with StatRad Radiology, all seeking permanent full privileges.
So moved.
Motion.
Second.
Got a second. All in favor, aye?
Aye.
Any opposed? No.
The next we have Dr. Amy Hassan as well as Dr. Martha Robinson with Tulane Neurology Telestroke, and they're seeking permanent full privileges.
You gotta do one at a time. Which one are you?
Dr. Amy Hassan and Dr. Martha Robinson are with
Okay, so
Tulane.
we're gonna do
Each organization. They'll go from Tulane.
No, you gotta do each person at a time. And we have to record the vote.
Okay. Okay, so we did Dr. Joseph Seifel, Dr. Kevin Kilpatrick, Dr. Jane Hurd with StatRad Radiology.
So a motion.
So moved.
Have a second? Have a second? All in favor, aye?
Aye.
Any opposed, no? Okay, that passes.
Now we have Dr. Jonathan Cole, StatRad Radiology, permanent privileges.
I'll make that motion. Second.
Got a motion and a second. All in favor, aye?
Aye.
All opposed, no?
Next, I have Dr. James Frencher with StatRad Radiology for permanent full privileges.
Motion. Second.
Got a motion and a second. All in favor, aye?
Aye.
Any opposed, no?
Next, I have Dr. Amy Hassan with Tulane Neurology Telestroke, seeking permanent full privileges.
So moved.
Got a motion? Second. Got a second? All in favor, aye?
Aye.
Any opposed, no? Okay, approved.
Next, I have Dr. Martha Robinson with Tulane Neurology Telestroke Permanent Full Privileges.
So moved.
Second. Got a motion and a second. All in favor, aye?
Aye.
Any opposed, no?
Thank you.
Please approve.
Next, I'm gonna call my friend up, Ms. Shavery. We're gonna go over our update analysis for our health system.
Yeah, you can do it. So thank you again for having me. So just kind of overview of the whole process again. So I'm happy to share that we have gone through the first 3 parts of this. And we're kind of moving toward the negotiation phases and the decision-making process. So we've kind of tracked our status throughout the duration of it. So we have finished the 90-day assessment. And so as mentioned, we're moving through the negotiation phase. We're leaning toward an affiliation agreement of some sort. And so we're still compiling what those details are going to look like. And once we have the details of that, we'll share that with the board, and then kind of bring that back to this group to discuss further. But throughout the time, it's been really good to understand the strengths of the organization, and how committed the organization is to the area, truly how dedicated the professionals are, and how committed everybody is to the growth of the area. So that's been really positive. And so we look forward to what this shared vision will look like for the community as a whole.
So next step, am I saying that right? Is it?
So it's pretty much to go through the negotiation phase, which we'll present the details back hopefully in April. And that'll take some time to kind of pull together what does that look like for y'all and to present it back.
Yeah.
I think Joint Commission kind of threw us for a loop this week. So.
Yeah. And all our visitors want to know we're talking about, we're negotiating with the lake. And this young lady here represents the lake. And so we've been doing ongoing negotiation. They've got a lot of information from us about what we have here, and we're moving forward.
Absolutely. All right, thank you all for your time.
Thank you.
Next, Mr. Dawson, we have our 2024-2025 audit response update. Like I mentioned at the last board meeting, we have engaged Lester Miller and Wales. They're conducting our annual audit. The audit is moving efficiently with significant milestones that have been achieved. Some of those milestones are our financial records and our statements, such as our trial balance, your general ledger, your reconciliation, your bank statements, our AR, your inventory, prepaid reconciliation, and fixed assets have all been sent to Lester Miller and Wales. Compliance and documentation, the contractual allowances, your bad debt. I made sure that our payroll liabilities, vacation holiday pay, and our prior year collections have all been submitted. Our policies and our governance, the Louisiana Compliance Questionnaire has been submitted. Your board minutes from 9/1/2023 to present, Lester Miller and Wales have those. Our key hospital policies, such as our sexual harassment policy, our ethics policy, our credit card disbursement, as well as our travel and expense, has all been submitted to our firm. And then our external review and coordination, signed balances for our prior attorneys, past audits with Laporte and Eisner Emperor, ongoing collaboration with Mr. Jason LeBlanc and Matthew Guidry, our CPAs for Lester Miller and Wales. We're continuing coordination to ensure timely audit completion. We did file that extension. We're waiting for that monthly meeting for approval. I had a email today with Mr. Jacob, so he has our update at this moment, and everything is moving where it needs to be. This is ongoing. We hopeful to be finished at our deadline, and our deadline is the April 30th. So we're on track.
Yeah, well, I think in talking to Mr. Wagerspack, we must have gotten behind somewhere.
Yes.
you know, the normal, like you said, we had to file this extension, so normally we would have had our audit already filed.
Yes, sir. Yes, sir.
So all I'm saying is for next fiscal year, we need to make sure that, I guess we got behind because we had all this, I don't know what the turmoil, maybe you could say,
Yes, sir.
in the financial department. We had a lot of changes that
Yes,
went
sir.
on. Is that correct?
And I take full responsibility on that. Myself and my team, we did not, we did have a lot going on at that time. However, we have put in control measures that we will not be in this situation moving forward again. You will not have to worry about
Yeah,
that.
well, as long as we learn.
Yes, sir. Lesson
And
learned.
so that, I guess that's what my main comment is that we need to make sure for the next year, which will begin around September, that,
I got you.
yeah.
I got you.
And this April 30th date here is okay with the Louisiana legislative
Yes,
order?
sir.
Well, he
So
hasn't
it's okay.
approved it.
He haven't approved it, but Jacob and I, as well as Lester Miller and Will, they're in constant communication. So we are working.
And just to bring everybody up to date, Jacob is the auditor for the parish. And so he's got to demonstrate to the parish that all of these organizations that have this connection to the parish, they have a term for it, I don't remember now what it is, that they're filing their reports on time.
So that was on your audit. The next, Ms. Crystal and I are going to tag team on the infection prevention policies review for approval. I do have 15 policies that we're going to go. It's going to be very high level. I'm not going to go into all the detail. Sherry can tell you those policies are very detailed and extensive, but we need to get them approved. Those policies went before ER committee. Then they moved into MEC, and now I have to bring them before the board. The board has to make the final approval so that we can implement our infection prevention policy for the hospital. Is Crystal on there?
Yeah.
Okay, so I'm going to just go ahead and start with key policies for approval. Infection control program plan. This gives a clear framework of the hospital-wide infection prevention. So this gives the authority from the board to give to me as the administrator to make sure that I designate our CNO, which is Ms. Anastasia Montgomery, the ability to run our infection prevention program hospital-wide. Quality improvement plan talks about your infection prevention and control. This is continuous monitoring and improvement strategies. Also looking at the CNO responsibilities in infection control. It defines her leadership role and her oversight that she has. Next policy talks about prevention and control resources. It outlines the tools and the personnel that are required. The next policy talks about your integration policy. So it talks about the coordination between departments. So it's talking about what nursing does with lab versus what they do with respiratory and what they do with the imaging department. So that policy is outlined. We do have our annual evaluation of the infection control program. This talks about the assessment and the updates to make sure that we're staying in compliance there. The next policy talks about the reporting policy. So it talks about the way that I have to report, I have to track for whether that be LDH or CMS. It talks about our communicable disease reporting policies. So this is our compliance with reporting guidelines for our public health. Also talked about employee health program policies. This is guidelines for safety for my staff and for the community. Employee absenteeism and sick call policy protocols to reduce workplace transmission. I'm gonna pause right there because we came out of COVID. And you remember with COVID, we was learning. So we needed to know how long one of our staff members have to be out or when they can come back to work. So we have worked, we have a very specific policy to make sure that we are key to that. So we have that. Employee incident reporting policy. So that insurance timely documentation of exposure or issues. You have your immunization policies, talk about my vaccines, Hep B vaccine policies, as well as your TB infection control program for screening, for testing, and prevention strategies. And then we have the overview infection control policies, general overview of the requirements of infection control practices that we have. So that's a very, Mr. Dawson like to use the word 3,000 feet look at the policies that we have. So those are your 15 policies that we have for today for board approval. All right. Ms.
Okay.
Crystal?
So we'll entertain a motion to do this in global. Are you ready for it?
She was just gonna say something.
Okay.
Go ahead, Ms. Crystal.
No, I just wanted to add that this is the initial framework for the infection prevention program for the hospital. We wanted to get this going, to get the framework, and that we understand what our requirements are for reporting. Additionally, every month past this, you will see a few additional infection prevention policies being sprinkled in depending upon the department, as well as the scope of practice and those that are practicing. So everything that Shelton went over, again, is just high level. It's the requirements of a program for Joint Commission, the requirements of a program for CMS, and after you guys approve, will be implemented from here on out.
Okay, so what we'll have to do is read this little blurb there and read them out for everyone, then we can vote on it, okay? Those policies for approval: infection control program plan, quality improvement plan, infection prevention and control, infection control responsibilities for the CNO, infection prevention and control resources, infection control integration policy, annual evaluation of the infection control program, infection control reporting policy, communicable disease reporting policy, employee health program policy, employee absenteeism and sick call policy, employee incident reporting policy, employee immunization policy, hepatitis B vaccination policy, tuberculosis infection control program, and overview for infection practices. So I think we can get them all approved in one motion now.
Yes, so I move that we approve all 15 policies.
Have a motion and a second. Any discussion? All in
I would
favor?
just confirm that these were recommended by both the ER and medical executive.
Yes,
right?
sir. Yes, sir.
And then if you review upon request.
And yeah, these were brought before ER committee with Dr. Panuclu and his team. This was brought before MEC. They met on the 18th, and now it was approved to bring before the board.
Further discussion? Okay, so we have a motion and we have a second. All in favor, aye?
Aye.
Any opposed, no. So they're all approved.
Thank you. Thank you. All right. So right now we're at our point that Joint Commission can come in today. Joint Commission is at our neighbors around us. We are moving a little faster than what I wanted to move. However, my motto is be ready so you don't have to get ready. So stay ready. Okay. So that's what we're practicing. That's what we're working on. Staying ready. So with that, I'm glad that our compliance officer, Mr. Reshort, is here with us this afternoon. So he, as well as Ms. Mitchell, that's online with us, and Mr. Jared, have been working collaboratively on our Joint Commission prep. And y'all know Mr. James, he has been all Joint Commission for the last, how many years, James?
I've done 10.
Last 10 years. So we are actively preparing for Joint Commission, okay? Leadership and governance. So my role is to make sure that from A to Z, that our policies are in place where they need to be at, making sure that our CMS conditional participation as well as our hospital standards are where they need to be, regular leadership, regular training, and giving periodic updates to our board. That's my role. Environment of care, life safety, that's a big one because that deals with our facility safety and our inspection. That also deals with our risk assessments that we'll be working on and our interim life safety measures that we have. Emergency management, that's updating our emergency operation plans, which we have done. Ensuring compliance with emergency preparedness requirements. Also looking at your patient care, that's on my nursing side. So monitoring and improving infection prevention and control measures, strengthening medication management and patient safety protocols that we need to have, documentation and compliance audits. So conducting mock Joint Commission surveys, reviewing your policies and updating documentation as needed. Quincy and James are working on next steps, which is staff education and training, and finalizing readiness assessments. You can walk around to the staff right now, and I ask the staff, what does race mean? What does pass mean? What do you do? What is our kill time? So the staff got to stop, because when they know I'm coming around, they're looking and making sure that they're doing what they're supposed to do, okay? Now, the thing is this here. It's not doing what you're supposed to do when Shelton's just around. You have to do what you're supposed to do all the time, okay? So that's the part of working to zero harm and getting us ready for Joint Commission. Mr. James, you have anything to add?
I want to emphasize a little bit on the education part. I've learned over the years, if I educate Ms. Shaver, tell her what to do, I can bring her through the drills on what to do and take her through each step. Yet still, if someone walk up to her and ask her a specific question, she may be nervous, she may be into something else, she may not know the answer. So that's why providing the materials that she can have access to is what they're looking for. They don't need you to know everything step by step and verbatim, but if you know where to get the information and have access to it, then we got it. So I'm teaching Ms. Shaver how to access the information she needs if she don't know it. So that's just a good thing as well.
Mr. Quincy, do you have anything you want to add on our Joint Commission prep?
No, nothing other than to say they're doing a great job. Everybody's working real hard.
Your window opens in July.
July,
Right?
yes, ma'am.
You kind of expect them around September.
Yes, ma'am. Yes, ma'am.
And we have lab in the hospital.
Okay.
Mm-hmm. Yes.
And Shelton, the board, we, over the last year and a half now, we know who is the Joint Commission. But for our visitors, could you just kind of define who is the Joint Commission?
So Joint Commission is our accrediting body. So we have CMS and we have Joint Commission. That is our gold standard. So Joint Commission is just the accreditation that we receive for the hospital. So they come through and they look at our facility from top to bottom to make sure that we are providing adequate health care, safe health care, quality health care for our community. So they come in, they do a full survey. And when they're doing a full survey, we're going to have a nurse provider or a physician liaison. You're going to have someone for facilities that are looking at the structure of the hospital. And then they take a look at our policies. And not only that our policies, well, they want to make sure that we have our policies, but they also want to make sure that Quincy has instructed the staff to know what the policies are and how to execute the policies. In addition, they could look back at our prior surveys. So when they look at our prior surveys that we had, they want to see what we did, okay? They want to know, what the plan that we put in place, and now is those plans being executed and it's been up to date. So we are in our window. We are looking. Jared has pulled everything apart. Quincy has pulled everything apart on his end, and now we have our plan. So now we're looking. We have a set of eyes on what we did then for what we're working on now, so that we can continue. All right. So, like I said, Joint Commission, they are in the area. However, I want to be prepared, and that's why we are working and focusing and making sure that making sure we put this as a high priority for our patients and for our staff.
And when they come in unannounced.
They come in unannounced. Yes, unannounced.
And it's one day, or they?
So
several days.
So it's a full week. So for a big acute hospital and tertiary hospital, they get their week. Now, look, I am critical access, so yeah, I'm critical access. So I'm saying 3 days, but Shaver had a week, so Shaver dealing with a week. So she's dealing with a week, but I got 3 days. But the thing is this here, they can do whatever they want to do. So if they want to say they want to be here a week, guess what?
And if they find something, they have the opportunity to come back a little bit more and dig a little bit.
Yeah.
But they let you know if they found something?
Yes, ma'am.
Yeah, they give you real time feedback, and then they give you a report back with all the findings.
So the good thing about Joint Commission, now they're doing what's known as a safer matrix. So that safer matrix is a building block. So it gives us a building block where you got the low, you got the moderate, then you got the high, then you have immediate jeopardy. I never want to be in an immediate jeopardy area. But Joint Commission is here to help educate, and it's about training. So they're going to find stuff to educate, to train. That's what they have to do. So we can keep it with the low and the moderate, and we're doing what we need to be. Yes, sir.
And one more thing, just to show us in mind, we are preparing for Joint Commission and get prepared pushing us to look beyond joint commission while we're thinking about policies. He's pushing us to envision the future and how we make council feel better. So it's a little, not as fast as we want to, but the long-term process will pay off because we're trying to envision how to make everything better. That's what he's pushing us all to.
Outstanding.
All right. Y'all have any other further questions? If not. So, standing education and announcements. February 2025, social determinant of health needs assessment. So, what we do, because this is a requirement, a new requirement for CMS, and all of my patients that come through the ER, we're asking them several questions. So we have 252 respondents. This is a significant increase in participation from my January numbers. It has improved patient data collection and engagement. Some of the key insights is on housing stability, as well as employment security, and as well as education and health. So you think about all that ties in, all that plays a major role. So what we are gathering is that a lot of my patients come here, they are worried about housing. They are worried about jobs. They're worried about food insecurity, and they're worried about education. So we are collecting that data. We'll be able to share that data now with CMS because that's one of our requirements that we do. So we are collecting that data, and we're being able to supply that.
Is this something mandatory?
Yes, sir. This is mandatory that we have to do. This is one of the new requirements.
Okay.
Chamber, correct. Yeah, these are the new requirements that we have to do monthly social determinants of health needs assessments. RestoreX with wound care. I've been speaking with our wound care team. Wound care was able to come and speak before our MEC. And I asked them bluntly, why are my numbers decreasing? Okay? Because, I want to be hovering around 50, 60 wound care visits, a month. And we did see a slight decrease. So I said, I want a very comprehensive plan. I need to know. So what we was able to determine that we're going to work better with our ER. So now we're going to improve my provider communication. So when we have patients that come there that have wounds and that need our wound care services, our physicians now are going to be able to send referrals to our wound care team. So our wound care team can be able to follow up with our patients to get them to be set up into the wound care clinic if they choose to. Okay, so you have to ask and make that option for them. And educating our ER staff on wound care criteria. The RestoreX Wound Care is going to be working on community outreach, involvement, and awareness campaigns. That's where Ms. Buggis is going to help us out on that. And as well as our lady auxiliaries are going to be able to start helping us to go into the community, go into the churches, tell them about our wound care program, and tell them about the services that we have here. So it's about being another voice and advocating and being able to speak for our community. So that's a positive that we have going on at the hospital. Education and training. Crystal and her team are working with Anastasia on BLS, ALS, PALS, to making sure that all of my nurses, all of my staff have the correct, and BLS is basic life safety training, being able to do CPR. And now I am offering it, and all of even my ladies auxiliary, they're going to be trained for CPR certification. So they're going to get that. But advanced cardiac life safety and PALS pediatric is required in my ER now. So the nurses are going to be required to get that, and Crystal and her team are going to be working with Ms. Anastasia to make sure that all of our nursing staff are certified there. And like I mentioned before, we do have the platform that is open and moving forward at this time. Mr. Price, you have an update on the van.
Yes, sir. Okay, everybody. Last year we purchased a transportation van, a small bus, to provide transportation for our patients here in our area. A lot of our people in our communities don't have transportation, so we felt that was something we needed to provide. So we secured this van, and what we're doing with it, though, we're getting the complete maintenance of it. It's in excellent condition, but we're doing some things to it. All right, so we get the maintenance. We changed out some of the tires and rims on it. We're gonna have a little partial paint done to it. We're actually gonna make this thing look very beautiful when we get it back here to the hospital. We're gonna wrap it with our West Ascension Parish Hospital. The wheelchair, matter of fact, it has a wheelchair capacity at the rear, so we can actually, the wheelchair lift can carry one person in a wheelchair at the rear, so you got seating capacity for 16 passengers, including one person in a wheelchair. All right, and we're gonna use that to pick up patients and bring the patients, bring them here and then bring them back home. And any other use that the hospital may have for it. So they'll be back here at the hospital probably in the next no longer than probably 4 weeks. And you're gonna love it when it's here. We're gonna put it to work immediately.
Do you have a plan for that?
Yes, sir. Yes, sir.
As far as drivers and gotta have a CDL license, is that correct? Yeah.
We, from prior to prior, driver, when we first got it, we discovered we didn't need CDL, we just needed a short.
Oh, okay.
And I'll further research that and get accurately sure we know what we're doing. I'll get the details on that and present that next board.
Yeah,
I don't remember I'm sorry.
No, get it.
I don't remember, but it seemed like we had some conversations with the Council on Aging.
Yes.
And there was some sharing that could go on there. Do y'all remember that?
Yes. And it is working. It is working. Yes, sir. Yes, sir.
Okay.
Yes, sir.
Okay.
Yeah, and it's gonna be good that we can just provide it ourselves. We got our own transportation, for our patients. And that's about to happen.
All right.
Well, we do know this is a large percentage. I heard the number today of people on the West Bank that have no vehicle. And it's somewhere in the 30% range. It's a big number.
Yeah, it really is.
Mm-hmm.
And the only thing was wrong with the council agency, they work well with our facility, we work well together. They have so many people they transport, and the patients that's a little bit more sicker than the other people, the wait time was hard.
Yeah. Okay.
The wait time was hard. Because you had to wait a while because they have so many patients they transport.
Okay.
All right. So the next is strategic service consideration for our board. You all task me every month to think of what we can do for next steps. What can we do for next steps? So one of the things that I think that we need to really look at is looking at primary care. And Shaver can tell you, primary care for our side, the Donaldsonville area, I do have several physicians that are getting up in age. So we need to think about what can we do now for recruitment and working with Shaver and her team, as well as what can we do on our own. So looking at primary care, I want to look at consideration for a mid-level nurse practitioner and looking at what can we do with a modular building on our site to be able to start utilizing 2 to 3 of our exam rooms to be able to have that circle continuum. I have a lot of patients that come to the ER, and like I mentioned earlier, who don't have a primary care. Okay, so they come to the ER and they use our ER as our primary care. What we want to do is we want to make sure that we have when you leave our ER, that you leave in with an appointment to see our nurse practitioner. That way our nurse practitioner can follow back up with you. Okay, so if you need an x-ray, utilize our services. Okay, you need a CT, you need lab work, being able to come back into the hospital. That's how we start to build. That's how we start to develop. That's how we start to grow. And that's how we start to move in a very healthy, preventative way for the community. So being able to improve and bring access and bring primary care for our rural community. Reduces ER visits by providing preventative care. This is also going to look at strengthening our hospital financial stability through primary care revenue. All right, and then I'm not opposed to a modular building option and looking at what that will look at on our site. But we have to think progressive. We have to think forward. We can't wait for someone else to do our job. These are our people. So we have to look as and do what the community is asking us and charging us to do. So just for consideration.
Doctors are across the street from us. Okay.
So we have 3 physicians and 1 nurse practitioner, or 2?
No, we have 3 employed physicians.
3, I'm sorry.
3 employed physicians, 2 nurse practitioners. We've hired another full-time physician that is Hispanic or Spanish speaking that will be starting in August. pediatrician that we've also hired that will be starting in a couple of months, probably around August as well, that also has a sickle cell background. And then we have a psychiatrist that will have some time as well. So while you guys are looking at growth, I would caution about doing that in a silo, right? You know, leverage the partnership and the relationships that you have.
Well, that's what I was gonna ask. I mean, is it possible we could do some kind of partnership for that urgent, for the clinic that's across the street?
Yeah.
Well,
Yeah.
I don't know if there's something we can do in the meantime, but I think in the long term,
Yes. Okay. Yeah, Ms. Crystal.
Hi y'all. I appreciate the opportunity to share this, and I do echo the sentiment of the relationship with Our Lady potentially. But what I would like to share is that the foundational step of a primary health clinic is very different for critical access than it is for a large tertiary care center. For instance, a critical access hospital would open a primary care clinic and then do a conversion to an RHC. Why would we do a conversion to an RHC? Well, that's because specifically RHC have all-inclusive rates that can literally nearly double the patient encounter of what primary care clinics traditionally receive.
She's still
Are you able to
talking.
hear me? I'm getting something over here.
Yes, we can hear you. We can hear you.
Okay. Okay. And so after the RHC conversion, we're able to bill at nearly double the rate because of the federal proposals. We can also look into the options for behavioral health, mental health outreach, looking at well child visits, as the lady there had presented as well. Partnerships look a little bit different when you have an RHC than when you're looking at primary care clinics. The other foundational step that our RHC would be able to provide is expanding our outpatient infusion and therapeutic services. So when we're looking at our patients that need a blood transfusion or an iron transfusion or just hydration or antibiotic transfusion, these are the methods that which we can refer within our internal organization and also increase capacity for our inpatient space as well.
Maybe we don't in the building.
RHC is our rural healthcare designation. Yeah. So, and being a rural community, it would be quick and easy for us to move that way. And Shaver can attest, you know what I'm saying? Having a partnership is excellent. You know, having that partnership is excellent. And also being able to look at that rural healthcare because you have that higher reimbursement rates. And you know, and I'm about to explain this. I live on my cost report. So I'm making sure that every dime is taken care of. And I'm making sure I'm looking at every dime. So being able to have a primary care that we can flip to RHC for our patients would be huge. Also looking at all kinds. I am a proponent of leveraging all types of affiliations that we can. What's going to do better for this organization and my community and my patients? I'm all for it.
So, Sean, let me understand this right. So the lake is currently providing various services as far as primary care is concerned. All right. So we want to make sure.
The problem is with that, and Shaver can tell you, is yes. However, all of their patients are not coming to me at this time. Okay, that's what we have. Fair enough. Fair enough. And we have to do a better job at that. Okay. For example, one of the things that we are focused on right now is looking at our EMR. You know, our EMR right now is Athena, and she's in a silo by herself. Athena is a silo by herself. We have other health agencies. You know, they're using Epic and Meditech and Cerner. They're being able to communicate. Okay, we can't communicate. So when you have physicians that come out and say, look, I would love to send patients here. However, you know, it's hard for me to be able to see what that patient did 2 weeks ago. It's hard to see that lab work. And if I'm having to wait to have, you know, my team being able to walk over with their medical records or fax over those records, that can become cumbersome. And as a practitioner, I wouldn't want to be able to do that. I want to be able to have easy access with my chart. So yes, that is a hurdle that we all are facing right now.
So if we merge, wouldn't that automatically
Not merge, affiliation, not merge.
Okay.
Yes, ma'am.
Partnership. If we partner with the lake, wouldn't that funnel those patients into?
That's a possibility. Yes, ma'am.
Right.
It's a possibility.
Okay. So what would cause it not to happen?
Right. So patients have always had the preference of choosing where they want to go, right? So patient preference is bad, but Epic will make it easier for patients to go from one facility to the next, right? So to what Shelton was saying, the electronic medical record will make it easier and seamless for a patient. And that some of the barriers presenting that are upfront and why the providers today find it difficult to get patients here because of the inability to get not timely results, but have it directly interface into the electronic medical record that exists today.
I'll give you a personal experience. My son got an eye in October. We went to Baton Rouge General Ascension, did all the tests, MRI, CAT scan, they transferred him to Children's. I have to pay for those tests again because the two systems wasn't glued together. And for this area, it's crucial because I have to do it in what, as a parent, as a client, everything you want to holistically look at it and help people help.
Yeah, so a plan, a plan for primary care is something I think that needs to be developed. One that doesn't conflict with the lake services that's provided already across the street. We've already talking to the lake about bringing in the Epic system. Okay, so we having that discussion. All right, so and you talked about 3 exam rooms. All right, and then now here at the hospital we are providing various forms of primary care for our residents because our residents can use more primary care here. All right, and it'd be great if we could provide it here. So I think we need a plan. I like the idea of the portable building. Okay, these portable buildings are available, right? There are various companies that will lease you a portable building. All right, because in our future, we're talking about building a brand new hospital campus. All right, and we're going to be able to incorporate a lot of these things that we're talking about here with primary care into that new facility. But a plan for primary care now, because our new facility is several years away. A plan for primary care now would be good, providing services that the current lake clinic is not providing. Of course, we're all going to be working together, and that would be great for our community here on the west side of Mississippi.
Well, I think we can, I would like to see us maybe approach that. That building is ours. And so, you know, can we do some kind of partnership with that group of doctors or through the Lady of the Lake when we have it? You know, I think there's a lot of possibilities, but one of them might be to look and see whether though we can do, at least for the meantime, we can do the primary care in that building that's across the street.
Okay.
We'll have to look at that.
Yeah, we have to look at it. I mean, I don't know where you know, I mean, what do they have? 3 doctors, average age of 90? I mean, I'm not saying anything.
Because on that, because then it's the billable rate. So we will have to bill separately. You have to have a separate address for that rural health. So that's the only thing that we'll definitely need to look. Shaver and I, we can look a little further and be able to bring something else before.
And bring a plan.
Yes, sir.
Yes.
So I'm trying to understand this, make sure I understand. Yes, so it would be the primary care lake here on this campus, and then it would be the primary care lake across the street.
I don't think we have any proposals yet. We don't have anything. We don't know how it's gonna work. We just stated what we open to discuss.
I think Shelton and I probably need to get together, have a conversation, and kind of bring that back to.
Yeah.
But the reason we wanted to start engaging in this consideration and this conversation, so that our board and our district can start seeing the growth and the potential that we have working with all of our players, but also being sufficient on our own. Because think about it, we have to be able to continue to provide those services and being financially stable. However, I will tell you this, we have to make sure we're doing what's right for our patients. And I will continue to advocate and fight for that each day.
Well, I mean, we need to look very carefully at a new hospital. Well, how are we going to do that? That we have maybe have a rural health clinic there.
Yes, sir. Yes, sir. It would take me around 24 months to have that complete designation. In that time, I can still be able to bill and be able to have my services where they need to be. But to get that designation, I have to be able to start working now to be able to put it in place so that we can be able to bill at 110% of Medicare costs, what we need, being critical access.
Yeah.
So,
Well,
again, this is just for consideration. Yes, sir.
We look forward to hearing another submittal on that.
Thank y'all. Thank y'all. Next thing is upcoming events. We have a LOPA ceremony. That was the Louisiana Organ Procurement Association ceremony. We are proud to be able to have our first LOPA flag raising, and it's going to be open to the public. So it's going to be April the 11th at 9 a.m.
What is LOPA? I'm sorry.
Louisiana Organ Procurement Association that we have. So we have an agreement that, for example, if someone passes away and they are an organ donor, they can be able to harvest those organs and be able to provide for other people. We do have a donor and a family, the Guillot family from Donaldsonville. They lost their daughter, and their daughter was one of the first in the area. So we're going to be able to recognize the family, recognize her for her contribution, and raise the flag on behalf of the Board of Directors and West Ascension Parish Hospital. We're going to be able to look at a plaque for her and for the family to be able to have in her memory.
What is that, Don and Peggy? Yeah.
Yes, sir. Yes, sir.
Okay.
Yes, sir. Yes, sir.
Yeah.
So the family has been made aware. They did confirm on the time and date. We did also reach out to the mayor's office, so the mayor's office is aware as well that we are having this ceremony. This is a positive for the community. This is also a good step for everyone to see that we are doing what we're supposed to be doing for organ procurement. On April the 12th at 10 a.m., the WAG Center, I want to see Mr. Dawson there in his bunny suit, making sure that we are passing out Easter eggs for the kids. Ms. Chantel, you're going to be there live for us. So that's at the WAG Center. So we're going to be glad to have that. Nurses Week is May 12th through 18th. This Nurses Makes the Difference is the theme. So we're going to have a full week of celebration for our nurses here at the hospital. And Hospital Week, the theme is America's Hospital, a symphony of compassionate care, May 11th through the 17th. So the same week, but we're going to recognize the hospital and we're going to do little things for the hospital. So that's good. Community Health Fair. So this community health fair is going to be on June 14th from 8 a.m. to 12 p.m. This is going to be here on site. The good thing is we're going to be able to partner with a young lady in the community, her and her team, that's going to help bring a difference to what we've had in the past. So yes, we're going to be able to provide SMAC. So SMAC is going to be with the blood work that everyone wants and everyone thinks about, and Ms. Buggage and them pay $10 and they get all their lab work for $10, and that's a great hit. It's a great service for the community. But also being able to provide health and provide education in that free preventative care that's needed in the community. We're also going to be looking at, and I really haven't spoken to my team, but I want to be able to have, snowballs. I like snowballs, Mr. Falcon, and everyone likes snowballs. I want to have a snowball truck for the kids. I want to be able to have, the band come back again, music, entertainment, being able to have even like a little small car show or something like that. But then being able to bring the community together, because this is your hospital, this is your community. So being able to have a nice health fair centered around health and what we're doing. Mr. Bell?
Yes, sir. And look, this year's community health fair, as Shelton mentioned, We're gonna have one of our active partners, which is right across the street from us here, Crossover Therapy. Of course, they provide counseling for our young kids that are mentally challenged with the ADHD, ADD, and other types of mental challenges. So they're going to be actively partners in this particular health fair, and this health fair is going to be huge. All right. Most of our services and most of the things going to be provided there are going to be free. The vendors will be able to participate free. There will not be a vendor's charge, and we're expecting a huge turnout for this particular health fair. We're going to contact our media people. We're going to show people how much we are engaged with our community. And we're going to provide all these different screenings, health screenings, for this particular health fair. So we're looking at
It's going to be here on our campus.
Yeah.
Yes, sir.
And we're going to use our properties
Yes, sir.
adjacent across the street here for various different types of activities.
So the challenge for the community, and my challenge that I'm given from the board and from our administration is, let's promote this. Let's make sure that we're getting out to the community, telling our patients, telling our community members, our neighbors, yes, you can have a community health fair. Yes, you can come up here and receive free services, learn about quality health. And Doc, you and I, we even gonna have to get us some Zumba classes up here, and they got this new dance now, Dr. Lee, about fans, boots on the ground, so we can even get a line dance on that. But it's about engaging everybody and being healthy. And healthy movement, healthy living is where we're going to be at. So I'm excited about the upcoming events. Y'all got any questions?
Easter egg hunt, who is the sheriff's office?
Yeah.
Yes, sir. Yes, sir. The sheriff's office. Yes, sir.
Just the sheriff's office,
Ms. Chantel, who else is participating with the WAG Center for the Easter egg?
I'm not sure, but a lot of times when they have they usually have.
Yeah, a lot of them.
Yeah, a lot of them. We participate.
Yeah. So this year we are preparing 1,000 bags. Last year we prepared, Shaver, we prepared 500 and we ran out. But it was good. And look, yeah.
We did go to the sheriff's office community event, so they told me about the incident, but I just kind of timed the amount of kids. There were actually 1,200 kids that came through for the Halloween, so we can kind of plan based on that data.
Yeah. So we want to make sure that every kid that comes, they have a bag. So we're gonna be able to do that. All right. Next is the CMS Medicare cost report, which was completed for our fiscal year. And for everyone, this is the complete final report. Okay. So I went through this. I went through, worked with our auditors. This is your Medicaid cost report. This is what we live by. This is our financials that we have. Ms. Tanya, I stayed up many nights getting this here prepared for us. But it's completed. It was accepted. It was approved. This is where we go off on all of our services. So my services for wound care, my services for radiology. So we look at all of the CTs that I utilize. I look at all of the labs that I use for PTTs and CBCs. Everything is in here. This is how we start the budget for our operational budget for our upcoming fiscal year of what we did in our cost report and how we're being reimbursed. So we look at this, we go through this, we make sure that everything is in line. On that, it is required by CMS for all Medicare and Medicaid certified hospitals. It also helps us to determine our reimbursements for Medicare and Medicaid. It ensures accurate financial reporting and compliance with federal regulations. For critical access hospitals, we live and die on our cost report. So reimburses cost-based payments instead of fixed rates, essential for financial stability, and like I mentioned, operational planning. And then it also supports rural healthcare by ensuring funding aligns with actual services. And as we are now in a era that we have to make sure that we are advocating for Medicare and Medicaid, it's very critical that critical access hospitals work with acute care hospitals, tertiary hospitals for our coalition, that we can make sure that we have a good thing with the federal government, the local government, and the state government to make sure that we're having the funding for our Medicare and Medicaid. That's another reason why we're glad to bring in Ms. Cynthia to help us and be an advocate. She has worked many years with the legislator and also on the federal level and on the state level to be a voice for West Ascension Parish Hospital. So we're going to be glad to have her here.
And Shelton, I want you to know we welcome Miss Cynthia Buggage, okay?
Mm-hmm.
Yeah, she has a lot of experience.
Yeah. All right. So data-driven financial decisions, guides budgeting and financial strategy, sustains essential services, ensures funding for inpatient, outpatient, and emergency care, regulatory compliance, so it maintains the eligibility for federal funding programs. So glad to have that. And now I'm going to turn it over. First, I'm going to turn it over to Mr. Jared, and then I'm going to turn it over to Ms. Crystal. They are our consultants that we brought in. We brought them in almost 9 months ago to help us. And you remember when we first took over, we had a lot that we had to do, all right, to get us to where we are today. So make sure that we're bringing in some subject matter experts that we can trust, that come from rural healthcare, that know rural healthcare, and can be able to speak to the challenges that our district have. When you look at our district compared to the districts that Jared and Crystal have worked through in the state, they have been very similar, and we have seen transformation. So it's been a pleasure working with him and Ms. Mitchell the last couple of months, but I wanted him and Ms. Crystal to be able to present before the board. I wanted you all to be able to get to know who he is and what he does, as well as the community. So it's going to be a brief for you. Yeah. All right.
Thank you all for allowing me to be here tonight. As Shelton said, we started this about 9 months ago. Had a really great opportunity here with a great team of people, and we looked at a lot of strategic things. What can we do to improve a lot of parts of the organization, and probably look close at some items that may need more attention. A little bit about myself. I'm from Lafayette. Most of my career was 31 years hospital administration, 200-bed hospital, Opelousas General. I was there for 31 years. Administration, wasn't the administrator, but I was chief information officer, chief transformation officer. At a 200-bed facility, 2 different campuses. If you've been over there, it's a pretty large place. But we still had the rural status of a hospital. So we were able to enjoy a lot of the same things you enjoy here as a rural status. Because once you get to an urban status, you have a very different playing field about reimbursement and different things. So what makes me good at what I do? Having built systems, EMR systems, implemented them, learned every department in the hospital, how does it function, got promoted over ancillary services, ran most of the facility, got nursing services under me, learned a lot from nursing, joined commission surveys. What does it take to keep an organization running financially with all the challenges of regulatory agencies that are constantly coming into your organization, telling you what you do right, what you do wrong. So I've learned an awful lot about how to run an organization and what to look for and a lot of the pitfalls you can avoid. I have a team of people, a couple of people work with me. Roshan Shah is a 340B specialist. I'm going to go through what 340B means. And Ashley Lorman is a lab specialist who's been looking at lab policy. Strategically, we picked these projects to look at in the last 9 months. We did an EMR selection process. We're still going through some of that. We looked at Athena EMR. optimization, your current system, what can we do with it to make it better? And I'll show you what we did, what we're still trying to do. Impact Billing is a company that does your billing, working with them. Setting up a 340B pharmacy. I'll go through that in a few minutes. What is that? Joint Commission survey prep, policy and procedure reviews. A new policy system was acquired to put all the policies in for when Joint Commission gets here and they ask, where is this policy? You can quickly get to it, and doing some senior leader mentorship. In the EMR selection process, we sent RFIs out to 4 vendors. RFI is a request for information. It's different than an RFP because an RFP is assuming you're going to buy. RFI means we're just trying to test the waters, what's out there. We sent to Meditech, Azalea, Cerner, and TrueBridge. I did have conversations with Epic. The cost was astronomical, especially for a facility this size. They generally want you to partner with a larger organization to run their product. There are some models that offer smaller facilities, but it still is unaffordable. I'm not sure why the scale is so high, but it really is unaffordable. In scoring these 4 different vendors, Meditech came out the highest because it actually had interoperability over to Epic, which it would send results back and forth. Azalea we're looking at now, they scored the highest. We're going to have demos next month with Azalea to see what their functionality does. Cerner's interoperability and missing some key modules brought their score down. And TrueBridge is the OCPSI product. It is missing some considerate amount of modules that are needed in the organization. So we're still looking at EMR. So the current Athena EMR optimization, we did a deep dive, both Crystal and myself, and looked through the system to see what problems exist and what can we possibly do in bringing the company in and determining, is it something that was originally not built properly, or is it just a functionality problem that it doesn't have? There were significant deficits in regulatory charting for nursing and ancillary departments. We identified action items, brought it back to the vendor. The response was their system couldn't do it. So we're sitting with a product that it's very limited in functionality. And so Crystal is working with nursing right now to make workarounds for regulatory requirements. And so it's going to be a paper process because we can't trust the system to have what it needs if a surveyor comes on site. A lot of the product is what we call outdated. So, and I believe they stopped upgrading the product a few years ago. We've asked them for some training and we've had a few sessions to see what could we possibly do to build in the system to appease some of the functionality that's missing. They gave us some order sets from other hospitals to compare to see if we could use them. Possibly we can. It's just an awful lot of build work that somebody would have to do, sit there and actually go through. And ultimately, it still would not have the functionality of the Meditechs and the higher end systems. So we're kind of in a state right now of, we're still interested in doing something, but there's not a whole lot that can be done with Athena. We're working with Impact Healthcare Billing. That's your billing company. We began weekly meetings back in July to determine the accuracy and the challenges existing with the current billing processes. Many reporting requirements were changed to identify important metrics that we needed to track and scrutinize. A lot of the buckets they were looking at in billing included a lot of types of accounts that should not have been put together. They had bad debt sitting in with good debt. So we had them break all these things down, start aging the accounts out properly, and we have a better handle on what the billing product is doing and what the billing company is doing for you. We made charge master changes. That's your charge that you bill the patient. The charge master was modified and brought the prices up to the Medicare fee schedules. In many instances, it was 100% below where it should have been. So all that was corrected in the system. We're looking at payer-specific denials. Again, Athena has problems with creating billing edits on the front end. So it's another challenge we're trying to work through. Bad debt was identified and we moved it out after 120 days, got it off of the AR, active AR, moved it in bad debt status. And recently we moved self-pay accounts to early out collections. So if somebody came with no insurance, they're not going to go through the normal collection process. They're going to go straight to an agency. If they set up a payment plan, if they apply for Medicaid, if they have an insurance application, those accounts will be held.
So tell me, does all this go away if we use Epic?
In so many words, Epic would be pretty much outsourced. Like if the link would come in and do your billing.
Or would all these problems go away if you had Epic?
Well, I don't have the answer to that.
Yeah.
Those other systems are options.
Well,
The other systems, I know it was 4, but 2 were pretty much chosen.
yeah, that's the top 2. Yeah, if you chose any of those 2, you wouldn't have these issues. This is an Athena issue. And a lot of it is set up, and we're identifying how to clean that up, and we've done a very, you can tell in the finances.
We're gonna have to move it along a little bit, okay? We've been here.
Yeah, I understand. Okay. Essentially, you've seen the work we're working on. You can see it in your finances. I mean, it's a lot of work everybody's
That was my question.
Sure.
Because I think it's very key. Average pay is 60% of bill charges across all payers. Our collection revenue has increased from an average of just $342,000 to an average of $576,000. Okay? So that is significant. That is huge. Working with Mr. Jared and Impact to make sure that we are bringing people to bigger hospitals. You don't see that in bigger hospitals. So the work that we're doing here is different in a sense, but is very rewarding and is showing off. Because we have a 60% increase just from 5 months of us taking over. Sorry.
I mentioned earlier 340B pharmacy program. Why did we need that? The government has a program in place for small rural facilities to buy pharmaceuticals at a very, very discounted rate. It allows your patient to get that rate, and you can actually bill it the normal rate. So you're getting the difference of the discount and the full price. So the organization gets the discount, and they also get the money when you bill the claim. With 340B, we looked at this organization, and there was a $75,000 to $90,000 opportunity in year 1. As your organization grows, that number grows. So we're looking at contracts with CVS and Walmart to be the 340B vendor for your patients. And what would happen is your patient would have the electronic prescription over to those pharmacies, and they would get the benefit of that discount. So we have the license established, and contracts should be signed next week with CVS and Walmart, and the software that handles the billing for the two different inventories, because the government says you have to have a 340B inventory and a normal inventory for pharmacy. Joint Commission prep, we talked about that earlier. I've met with several departments. We looked through the last survey and went through all of the deficiencies, identified whether they were remediated or not. If they were, prove it. Is it still fixed? If it's not, what are we doing to work on it? Also around that, if the Joint Commission's coming right back to that spot when they get here, and they're going to say, where is this? Is it fixed? They're going to see it's fixed, and they're going to look around it. They're going to say, oh, well, look, you have a firewall penetration right here, and you didn't caulk it properly. Or they look at the fire extinguisher. Is the date right on the tag? I mean, they look at everything. So anyway, that's what we went through. I went through all the policies for lab, respiratory, plant office, environmental care, dietary, and we made a lot of revisions, and they're ready to be put into the new policy system called MCN that we're implementing right now. In a nutshell, that's it. So, any questions?
Sounds like a good investment.
Yeah.
Chris, do you have anything you want to add right fast?
I can be very quick, and your time is very valuable and it's the end, but I haven't gotten to meet quite a few of you yet. I'm Crystal Mitchell. I'm a healthcare executive. I've served in every executive position of the hospital except for the one titled CMO and CFO. I currently am the Chief Operating Officer at Southern Inbound. We are a Louisiana-based consulting company. We're in 28 states and I have over 20 consultants that work with us. My goal for you guys has been making sure that you are reporting where you're needing to with CMS, staying on top of all the regulatory changes, being ready for your JCO Joint Commission upcoming survey, helping Ms. Anastasia to understand where the gaps are in clinical efficiency and partnering with operational efficiency to increase any type of financial outcomes. You'll hear me talk a little bit more about swing bed status, outpatient infusion, other opportunities to bring there on-site at West Ascension. That what we do is work with other critical access hospitals across our great state of Louisiana, and we would love to be able to partner with you guys to continue to help West Ascension grow.
All right, thank you.
Well, Shelton, I want to thank the gentleman here. I like the report you just gave us, sir. Thank you for the work that you've done for us. Crystal, I want to thank Crystal, all right, for the work that you all have done for us here at West Ascension Hospital.
Thank you. So I'll be very brief on our investments. For the RFP for investments, it's finalized for posting. I will have that for Mr. Dupaty this afternoon. The purpose just to identify security investments and looking for other potential. So we will put that out. That will have a 30-day. That 30-day will be given to the board, and then you all will be able to work with Mr. Dupaty.
I was thinking that you do a request for entries first. You got to figure how we're going to pick who you're going to send all these to request for information proposal. Normally that would go, you would ask for, are you interested in this? And then those that are interested, they get the request for proposal.
Okay, well, we will get that, and that will be modified, and Kenneth will get that to you.
And I think we need to, I don't know how, look at least all the financial services organizations in Ascension Parish and
yes, sir.
Maybe the neighboring parish.
Gotcha. So on your USDA Distant Learning and Telemedicine grant, that grant has been completed and submitted. The purpose is to expand access to post-acute care services and to improve patient outcomes, enhance patient rehabilitation for rural residents, and bridge healthcare gaps in Donaldsonville with telehealth. This is just going to be able to improve your rural patients for this area. So we are awaiting the grant notification. As soon as I get any words, I will make sure that the board is made aware of that. So we have that. But that grant has been written and has been submitted on our behalf. Next thing is that's budget planning and overview. We basically talked about the budget planning. We are in the process now of starting because I have to be able to bring the proposal to the board. Then after we approve it here, we have to go to the parish and I have to present at the parish. So we're getting ready for our fiscal year. So I am starting to work with Jared and Crystal of bringing in all of the cost report and what we did prior, what we're looking at now, and what we're projecting to be. So I'll give you some more up-to-date information on that. But I just wanted to share that with you all.
Well, I think you need to talk to Ms. McKee, the parish secretary, Senator McKee, and see whether you need to go through a committee or whether you can go directly to the council.
Okay. So that'd be different from what we did last year? Okay.
We just need to verify that today.
Okay.
That's the way it should go, but I
We've talked about it.
Yeah, I want to get the.
We want to do everything right. Yes, sir.
I don't
Yes, sir.
want to walk in the council and then tell us, oh, you got to go back to finance.
Yeah. Okay. Well, Kenneth, keep it right. Keep it right.
I spoke to her about it.
Oh, you spoke to her about it?
Yeah, it's very clear.
Okay, all right, then, disregard that.
All right. Well, I will have that. We will start working, and then I will be able to bring that proposal and that budget up to you. And then, if approved, we can be able to move it to the parish. Yes, sir. Last thing is turn it over to Mr. Dawson. Thank y'all. I have did my time. Mr. Dawson, you want to go over your proposal? Mr. Dawson, your proposal for your master plan?
Oh, yeah, right. So, Glenn and I met with a representative from Jerry Abear's, Grace Abear and Associates on their architectural firm. And I've got the guy's name. It is Land, his last name.
Land, Barry Land.
Barry Land. And he has a tremendous amount of experience in rural hospitals. And so what Glenn and I brought to him was we'd like to get a proposal for a master plan, realizing that that's gonna have a lot of flexibility to it, but every day something changes, and people that are near to us want to know what's going to be where and what have you. So I wanted to get just a high view. This thing might change, but I wanted him to go in and look at what buildings we need based on how much is going to be, which ones are going to be relocated and which ones are going to stay there. And then how much parking and where these things can fit, so that we can figure out what do we have on the 12 acres that we have behind over here. So I'm getting some, as maybe I told you, that River Parish Community College wants to locate it right here. So they need to know how much of that we're going to actually use, how that's going to work. So I think it's about time that we put together some kind of master plan that we can look at and see what buildings could go here, what buildings and parking can go there, so we can have something that we're looking at through the rest of the process. I'm not saying that what we do with the Lady of the Lake is not gonna change a little bit, but I think that's where we need to be for right now. And Glenn and I are both support the idea that this is the right guy to do it. He has a lot of experience. He's done. I sent out to the board some samples of what he's done in the past. And Jerry Abear is a West Bank guy. He owns the company, so I feel pretty comfortable that we can go back to him and, if we have a problem.
And Grace Abear and Curtis, architects and engineers, have done a lot of work in the state of Louisiana. They've done a lot of projects. They've done a lot of hospital projects. They've done a lot of hospital projects for rural hospitals, critical access hospitals like we are. All right, so they want to develop this master plan, show us a model, show us what a new facility would look like, also including in there to let us know whether or not certain renovations or ideas for our current facility, a complete master plan for our future as it relates to building our new hospital campus here.
Okay, so any questions on the board?
Any questions, comments? Okay, so we have their proposal here, and I would like to make a motion that we allow Grace A. Barron Curtis to develop a master plan for our facility here and for our potential new facility, our new hospital, at a cost not to exceed $45,000.
Okay, so we have a motion. The second will allow us to have discussion. Okay, motion dies for lack of a second. All right, the next agenda item, is that the last one?
That is the last one. So thank you, Mr. Dawson, thank you, board, thank you, community members, I appreciate y'all coming this afternoon, and hearing what we're doing for the hospital and what we're doing for the community. It is a very exciting time, here at the hospital, here in the district, and we're just gonna continue to move forward. The staff has been working hard, our patients are coming back, they're trusting the hospital, and it's because of each and every one of you. We are here to take care of our patients, and I want to thank the board. Thank you all for everything.
Thank you. Well, I'll entertain a motion to adjourn.
Are you ever going to open it up for public comment?
I'm sorry?
Are you ever going to open it up for public comment?
We opened it for public comment at the beginning.
Right, but on your agenda, there's a public comment.
No, the agenda has a public comment at the beginning. But if you want to comment, if you have a comment, then I'll let you comment. This is the first time we've changed it. So we have the public comment at the beginning, and you sign up for it. But if you'd like to get up right now, and I'll give you 3 minutes. We need your name.
My name's Spencer Shohan. And I thought when you changed the agenda, you had to do it within 24 hours.
We did.
I printed the agenda this morning, and it still shows public comment on here.
Well, I don't know, Austin.
Well, Mr. Shelton, I think you're doing a wonderful job. I think this hospital is lucky to have you. I think you're a fine man. Mr. Dawson mentioned something earlier that really caught my attention. He mentioned that the half-cent sales tax will see a significant increase from where it stands today. I think it's prudent that I remind everyone and just state for the record that Mr. Dawson just 6 years ago led the effort to strip that sales tax from this very hospital. And this good hospital. Thank God he didn't get his way. I also noticed that the board unanimously approved the meeting minutes from the February 27th meeting. That meeting was video recorded last month, and like many others in the recording, it's quite clear that Dawson just let the public speak one time during the entire meeting. Yet this board's meeting minutes that you just approved, one can clearly see that they've been falsely stated at the end of each section. It was opened up for public comment. This did not happen. This wasn't a simple clerical error. This is what's known as vanity. And that's what's driving this board's reluctance to pay Henry Chauvin. Simple vanity. And this vanity is costing the good taxpaying citizens of Ascension Parish thousands of dollars. Vanity is the other reason why this board has refused to provide us with a video recording of that very first meeting it held. Now, this board's official response is that the recording cannot be found or it doesn't exist, but I was there and I saw it being filmed. I'll provide the media with details as to why this board doesn't want that video to be shown, but withholding public documents is a serious offense. And destroying records is even more serious if it turns out that that's what happened. Not to mention, it just looks bad for you guys. It looks like you're hiding something, especially when the vice chairman of this board frequents the sheriff's office so often. Now, when Chairman Dawson was asked by the advocate about Price's status on the board amid his criminal accusations, he was quoted as saying, those are accusations, and I understand they're serious accusations. However, the board itself doesn't have the authority to remove or add anybody to that board. That's the Parish Council of Ascension. But is that entirely true? They're not all simply accusations, are they? Certainly the 18th District Court judge ordered restitution payments of $50,000 to be made, and if Price himself admitted guilt in the same case...
Listen, Mr. Chauvin, you can't personally attack somebody else.
I'm not, I'm quoting the paper.
Additionally, you have to talk on the agenda item. You're here to talk about the executive session that we're gonna go into for the Chauvin.
Well, you just said I could have a public comment.
Is that correct?
Yes.
The public comment you can't cover the whole world with that. You have to comment on that agenda item that you came up here to talk about.
Are you not interested in hearing from the public?
I'm interested in hearing what you have to say about the agenda item.
Okay.
I don't want your personal views about anything, and it doesn't belong in the podium.
It doesn't belong here because you just don't like what it has to say.
Well, let me just tell you this. You still have a minute or so go ahead, but
okay.
I warn you that it's not a place to attack people. It's a place to talk about the agenda item.
Well, these aren't my words. And these weren't my actions either. So, the judge ordered $50,000 to be made, and if Price himself admitted guilt in the same case, that's more than just accusations, as Dawson so trivially phrased his response. Where's the line drawn in which one is removed from the board? It apparently hadn't been crossed yet. The parish council's silence on this subject is deafening. Yet, in the Prevost Hospital meeting minutes on December 18th, page 13, it's clearly stated that the board itself, in which Dawson is the chairman of, made motions to renominate themselves individually and by unanimous motion, carried the reappointment of all existing members as officers for the year of 2025. Why did this board with no power re-elect Price as vice chairman? This too seems to be a case of vanity. They certainly had the power to not re-nominate and re-elect him as an officer holding the title of vice chairman, all while still remaining on the board. This shows us that Mr. Dawson minced words and avoidably made that statement as to shift the responsibility.
So, Mr. Chauvin, your time is up.
Responsibility of choosing to condone Price's questionable character strictly and wholly to the parish council, absolving himself of that duty in which he and the other commissioners hold. But the people of Ascension Parish know better. At least they do now.
Your time is up.
This should be interpreted that the other commissioners condone this behavior as well, being the re-election was unanimous and without contest.
I'm going to adjourn the meeting.
Now we see that this is unanimous vanity.
Yeah.
Bill, look at that.
We're going to temporarily adjourn the meeting until the...
Yeah.
All right. So we can go back.
Thank you for hearing.
Go back to our